Hi, my name is Kathy Johaan. I'm a licensed clinical social worker here at Indiana Physician Associates. I received my degree from University of Illinois in Chicago, and Indiana happens to be home for me. So lived in Chicago for a while and came back, and now I'm working here with Dr. Adkins, Dr. Hull, Dr. Johnstone, and Nurse Holly Hancock. Sometimes people want to know about my training and background. Well, sometimes they think, oh, you're a psychologist. Well, actually, no, I'm a licensed clinical social worker. I have a master's degree in social work. In terms of what's the difference between a psychologist and a social worker, psychologists do a lot of testing, like if you needed some IQ testing or something like that. I don't do any testing. I don't prescribe any medications. But what I can provide is therapy for people, mental health therapy. I get referrals from the physicians. I get referrals from insurance companies or from other clients. People sometimes ask, well, why would I want to come and see a therapist or a counselor? I just happen to have a different set of tools in my toolbox. So when people are experiencing just difficulties in life, it could be adjusting to a new diagnosis, it could be dealing with pain management issues, depression, anxiety, grief and loss. It could be a variety of things. But the purpose is to help people adjust and create the best life that they can, the happiest life. And so sometimes people want to know, well, what do we do? Well, you just come in and we sit down and we have a conversation. Tell me what it is that you want it to be different in your life, and we kind of problem solve what needs to be different. And I may give you suggestions, teach you some new skills. I guess what I'm trying to say is it's your life. You get to decide what it is that you do. My goal is just to help you learn better ways of coping. For example, sometimes people come to me when they're having difficulty sleeping at night, so we're going to kind of take a look at what may contribute to that. I get referrals from the doctors about, somebody is having problems with stomach ache or stomach issues and they're having difficulty sleeping. So we just kind of sit down and have a conversation about what kinds of things you can do differently so that you can get a better night's rest. If you think that you might need someone to talk to, someone that is neutral, doesn't have a side, my only investment is in you getting better or feeling better. You'll see me around the office. I might pop in and say hello to you sometime in an exam room, just as a way to introduce myself and my services. So if you'd like to get in touch with me, you can contact me here at Indiana Physician Associates at the number.